Dr. Williams, patient safety is paramount for the American Society of Plastic Surgeons. So why are doctors who are not formally trained in plastic surgery performing cosmetic procedures?
The challenge is there's financial motivation for other specialties to perform plastic surgery. And we've seen it time and time again where someone who is either not board certified at all or board certified in another specialty chooses to try to do largely cosmetic operations because that's where the money is, and then someone gets hurt. And so this is unfortunately another example of that.
Of course, seeing a board certified plastic surgeon is always the standard of care for patients. Is it enough to see somebody who is board certified, or do you need to check the type of board certification that they have?
The American Board of Medical Specialties specifically delineates different board certifications, and the term cosmetic surgery is not one of them. And so if someone is telling you that they are board certified by the Cosmetic Surgery Board or they're board certified in cosmetic surgery, that is a warning sign that they are not being completely straightforward with you, because that is not an official board certification.
But also, even if you're board certified in another specialty, that doesn't prevent you from doing cosmetic procedures, correct?
That's correct, and that's part of the challenge. If you're board certified in pediatrics, you can do liposuction, and that is exactly what happened to this unfortunate patient. In the United States, generally, if you have an MD, you can perform any procedure you want. Does it mean that it's the right thing to do? Does it mean it's the safe thing to do? No, absolutely not. You should be doing procedures that you are specifically trained for. And generally, a pediatrician is not trained to do liposuction.
What makes a board certified plastic surgeon the most qualified person to see for a cosmetic procedure?
Board certified plastic surgeons are people who've completed medical school. They've done a formal plastic surgery residency and training program. They have taken a written exam about specifically plastic surgery, including aesthetic surgery. They have taken an oral exam 2 years later, specifically about aesthetic surgery and reconstructive plastic surgery. They are required to undergo continuing medical education to maintain their certification. They are required to have ethical standards that mean that they are providing care not only in a safe and effective manner, but they are being truthful and honest with the representations and how they manage their patients. There are so many different factors that we are held to. There's so many different important guidelines that we have to follow and standards that we are held to that anyone who's not a board certified plastic surgeon, they don't have those same obligations, and patients can get hurt.
Why do patients need to check on a facility accreditation as well as hospital privileges when they go to see a doctor about a cosmetic procedure?
You can do your own research. And again, I think we've talked about some of the tools that can be helpful. Are they a member of the ASPS? Will they show me their board certification? It should say board certified in plastic surgery. But a more direct question can be, does this provider have hospital privileges to do the procedure I'm interested in? And if they say no, that's a warning sign, because most board certified plastic surgeons should have privileges at their local hospitals to perform the procedures they may do in their office or at an ambulatory surgery center.
And Dr. Williams, ASPS has been extremely proactive in helping patients locate board certified plastic surgeons for many years.
I think that ASPS, one of the roles we have is to promote patient safety. And we have done substantial marketing campaigns. We've had substantial advertising campaigns about patient safety and about the importance of board certification. We work at the state, local, and federal level in terms of advocacy to try to have more truth in advertising laws, so patients aren't getting fooled and being put in these situations. We want patients to be safe, and it's important that patients do their research. But a lot of times that term, do your research, it's not enough. And as the president of the American Society of Plastic Surgeons, we will continue to try to support patients to try to create safer pathways, more clear pathways where patients can find the procedures they're looking for in a safe manner, and make sure that tragedies like the one that's just happened don't continue to occur.